We say it all the time simply because it is true. Chattanooga is most definitely a runner's town, a walker's town. If you've been running for any length of time, though, there's a good chance your knees might take a toll. So what do you do and how do you trust the answers you're given? Dr. Bradford Mitchell joins us this morning. He is with Center for Sports Medicine, and he said, Julie, remind them I am non-surgical here, so I'm going to try the easy way out first. So good to see you this morning.
Thanks for having me.
So you're wanting to focus on something, and you'll have to tell me the name of it again, but a lot of people who run or are just strong exercisers might suffer from this. It's pain at the front of your knee. Is that right?
That's right. Yeah, one of the things that it's referred to is runner's knee, but similarly to like tennis elbow, it's one of those things that not just runners get runner's knee, and more than just your tennis player gets the tennis elbow. So runner's knee, the diagnostic term that it refers to is something called patellofemoral pain syndrome or patellofemoral friction. And basically the patella is the kneecap and the femur is the thigh bone. And so it refers to a condition where there's pain in around the kneecap and where it moves up and down this groove called the trochlea in the thigh bone.
So when you said it's not just the runners who suffer from this, we have a lot of hikers around here. Is it just any kind of repetitive motion that eventually erodes that a little bit?
So yes, and it can happen in folks that aren't as active either.
Really?
So basically there are a few different things that kind of contribute to this. There's the repetitive motion aspect. So every time you take a step, and if you're taking tens of thousands of steps a day and you're an ultra marathon runner, then you're predisposed to, when there's friction underneath the kneecap, that 20,000 steps in a day and more, you'll feel it more. The other thing that really predisposes folks to having friction and pain around the kneecap is when there's an imbalance or weakness in the soft tissue structures of the knee and hip. So tightness in the outside part of the knee can cause the kneecap to kind of get pulled outside or laterally. Weakness in certain muscles can predispose folks to the kneecap not moving up and down the thigh bone like it's supposed to. And then one of the more common weakness, muscle kind of weakness patterns that we see is hip weakness causes the leg to rotate in a way that causes the kneecap to move to the outside of the kneecap, so it doesn't. There's more friction and pressure and pain.
It kind of feels, Dr. Mitchell, like the worry of what lies beneath, because a lot of us are living our day every day and we think we're doing the right thing by exercising and eating healthy and all that kind of stuff, but you can't know what toll it's taking on your body. So if they come to you at Center for Sports Medicine as almost just like a routine maintenance, is that helpful sometimes?
Yeah, I think in general, movement is medicine is one of the things I tell folks. So that is true, and yet pain is kind of one of the body's ways of communicating that there's something going on, there's something wrong. And so, to kind of reassure you, I mean, sometimes that pain is as simple as there's no major, huge structural injury that's gonna change your life forever. This runner's knee condition is one of those things that thankfully we can kind of stop and avoid the things that really exacerbate the inflammation around the kneecap. Do oftentimes non-steroid anti-inflammatory medicines. And really that helps the inflammation calm down. Work on a kind of focused physical therapy, stretching and strengthening program. A lot of times bracing can help as well. We kind of focus on the alignment of the legs. So sometimes arch support inserts are important for folks that their foot turns in and therefore their knee turns in. Mm-hmm. But anyway, oftentimes this is one of those things that gets better and doesn't lead to major issues down the road.
Okay, and we're all bad about playing Google Doc. So in case people are thinking, because you hear a lot now about, cartilage and decompression needs and that type of thing, that's not what this is as much. This is just inflammation behind your knee. Is that right?
That's right. And yet, I mean, I will say a visit with a sports medicine doctor, an orthopedist, to kind of know exactly what you're dealing with, because you can have front of the knee pain, front outside of the knee pain, and it can be just inflammation, like you were saying. But you can also have signs that are concerning for a deeper issue of cartilage wear and tear change underneath the kneecap, or tearing of cartilage in other parts of the knee. So it is helpful to kind of get a firm diagnosis before you start moving down that treatment
Then
pattern.
let me take that to springboard then into how people can get in touch with you. Are you only at the McCauley office, or do you spread out?
We have a few different locations. So I'm up at our Battlefield Parkway office the majority of the time, but I'm at the McCauley office some as well.
Okay, then here's that number. Here's that number from McCauley, 624-2696. You can call that number, and then they'll let you see what his schedule looks like at the other locations. Also online at sportmed.com, you can learn more about the practice there as well. Dr. Bradford Mitchell, thank you so much.
Thanks for having me.